Hello and welcome to Packing Your Backpack with Coping Tools, supporting students and building family resilience during the pandemic. I'm Lauren Marlotte. I work at the Division of Population Behavioral Health at UCLA, and I'm the Director of Learning and Development. I live here in Minneapolis and have been working remotely for UCLA since the fall. And I'm really excited to talk about this topic today. A lot of the work that the Division of Population Behavioral Health does is centered around family resilience, family coping, and a preventative approach to supporting families experiencing different kinds of stress and trauma. I take this approach of a family-centered lens because supporting family systems can help individual family members as well as support the cohesion and unity of the family system. And I mean family in a broad sense of that term. It could be biological family, chosen family. There could be supportive adults who are not living in the family home that can be a source of strength and resilience to use these skills with young people. I'll also be talking about skills that are applicable to lots of different ages and developmental stages of children, so that these skills can be used for a wide variety of family systems. But keep in mind, as I said, the definition of family is very broad. It could be a resource or foster family, a biological family, or extended family members as well. These skills are meant to support lots of different types of audiences. If you're coming here as a caregiver or a parent yourself, if you're an educator, if you are a healthcare worker, a mental health care worker, the goal is that all of these skills could be applied in different settings, and that you don't need any specialized training or a specialized background to use these resilience skill building and to work with families in the setting you're already working with. So here's what I'd like to cover today as we pack our backpack with coping tools. I'll do an opening activity. I'll go over what we know about the impact of stress and trauma on children and the little bit of literature that's already been published on the impact of the stress of the pandemic. I will present to you an acronym called PREPARE, which supports children and adolescents in managing stress, specifically today around the pandemic. But these tools and recommendations can be applied to a lot of different stressors as well. I'll talk about some specific resilience skills, and then closing out with support for adults and some specific strategies for educators. So I'm going to be referencing many different tools, and these tools are free and publicly available on the focusfoster.org website. The website is intended to provide resilience skill building with some specifics for foster families, but all of the handouts are generic enough for any type of family. There's nothing specific to foster families in the handouts. There are some videos and resources that are specific to foster families. So once you go to focusfoster.org, you'll see a resource library towards the bottom of that page. And there you'll see our publicly available handouts, and you'll see which ones are available in English and which ones are available in Spanish. So to get us started, I'm going to walk you through this handout, and you actually don't need the handout. Any piece of paper will do. And the idea is we're going to start thinking about strengths and family strengths, so that as I talk about stress and trauma and the impact of the pandemic, we can also have our strengths at the forefront of our minds to help buffer the impact of both talking about the stress and living through this stressor. One of the unique things about the pandemic is that it impacts everyone. Now, it impacts everybody differently, but there is this sense that everybody is impacted in some way. We are all experiencing heightened stress And that is having a profound effect at a systemic level in a very unique way. So the first thing I'll have you call your attention to are to think about your top 5 strengths. What are your strengths? What are things that your friends would say that you do well? What would somebody compliment you on, especially if you're having a hard time thinking about your top 5 strengths? And I'll pause for a moment to allow you to think through those. These could be things like being a good friend, being a good listener, being compassionate, being caring. Now I'll invite you to think about your support system. What are your friends' top strengths? Maybe your closest friend or your group of friends. What's great about your friends' strengths? What do they bring that is positive? And finally, what are your family's top 5 strengths? This could be the folks you live with. This could be however you define your family. Are you caring and loving? Do you enjoy having fun together? Are you supportive of one another? Do you have good communication? Are there ways that you organize yourself? You have a good system for chores and responsibilities? We often don't think about strengths. We are wired as human beings to notice the negative so that we can protect ourselves. It goes back to our the ways our brain were formed evolutionarily. We need to be on heightened response in case something dangerous happens. And particularly right now, when we're all experiencing increased stress, is a time to build our own resilience and recognize the things that are going well so we can use those strengths to help us as we are combating stress, as we are coping with stress, as we are experiencing pressure of the impact of the pandemic. Now, we're going to focus on specifically how this affects children and ways to support children. But it's also important to keep in mind that you, as the caregiver, the provider, the educator, is also experiencing this. So, what do we know? We know from decades of studies that the kind of stress and trauma that children are experiencing during the COVID-19 emergency has the potential to actually embed itself into children's DNA, which dramatically affects their brains and other critical body systems, such as their health, across an entire lifetime. Now, we know this from previous research, such as the Adverse Childhood Experiences Study, which found that the more adverse childhood experiences somebody experiences, the more likely of adverse consequences later in life, even things that weren't directly related to stress, like physical health challenges. The science of early childhood development tells us that the stress of COVID-19 could put children at higher risk for kind of obvious things such as hunger, homelessness, abuse, and neglect as a result of the impact of the pandemic, as well as longitudinally potentially developmental delays, asthma, diabetes, increased chance of mental illness, heart disease, cancer, Alzheimer's disease, and other types of poor health outcomes. We also know that the fallout will be the worst for children who are already living in poverty and already experiencing adversity before the pandemic struck. This disproportionately affects children of color who have disproportionately felt the health and economic impacts of the combined impact of the public health crises and the impact of racism. The public health and economic disaster is exacerbating contributors to children's poor mental health and brain development, such as food insecurity, increased domestic violence, increased lack of access to health care. The cumulative trauma, so the number of different types of stressors and trauma, impacts the long-term mental health symptoms and increases the potential for those. And there's an increased weight and increased importance on the family system. So supporting the family in managing the stressful time as people are torn in different ways to meet many different obligations and have many different types of increased stressors. Now, it's not all doom and gloom. There have been some really positive parts of the pandemic. So even though there's an increased risk of a lack of mental health care, many providers have shifted very quickly, if they didn't already have a telehealth practice, to be able to provide services through a remote platform. And similarly, some of the systems, such as insurance, have adapted quickly to be able to cover services that are delivered remotely. This is probably the most obvious part of this talk. Pandemics are stressful. Public health actions such as avoiding people, physical distancing, this all increases the chance of being lonely, feeling isolated, having increased stress and anxiety. Also, exposure to both negative and positive media images increase the chance that somebody will have exposure to, will develop PTSD symptoms. So negative media images are things like the images of death, illness, injury, and positive images like heroes and our frontline workers are both have a detrimental impact on mental health outcomes. Interestingly, internet exposure as a media source had the highest risk of someone developing PTSD type symptoms, post-traumatic stress disorder type symptoms. There are certain things that put young people at increased risk of having stress reactions. So if the exposure is longer, which unfortunately the pandemic has gone on for quite some time and we don't have an end in sight. So that puts us globally at increased risk, especially our young people. The sense of threat that a young person experiences, if they think that their life is in danger, that is an increased risk. Being separated from caregivers or parents, this could be because the parent is getting treatment. This could be because the parent needs to be separated for work reasons or other reasons. If a child experiences greater pain, they're at greater risk of a stress reaction. If they've had previous traumatic or very stressful exposure, that puts them at higher risk. Prior behavioral or emotional challenges, previous experiences of post-traumatic adversity, such as already experiencing poverty and economic hardship, already having conflict within the family. And then parents and caregivers who have the exposure to trauma and stress, which of course is happening as a part of the pandemic, puts young people at higher risk of stress reactions. There is some hope. We know that kids are very resilient. Developmental trajectories are not set in stone. And there are protective measures that we know that supportive adults can take to help support children. What are some of those? Well, we know from lots of different research that children with one secure attachment is going to be a huge protective factor. Now, other safe, stable, nurturing, supportive relationships are also helpful. So if you're listening to this as somebody who's predominantly interested from the perspective of an educator or a different type of provider, you having a safe, stable, nurturing, supportive relationship with a young person is also a protective factor. Spending quality time together as a family. This doesn't need to be anything expensive. It certainly doesn't need to be anything grand, but having that quality time as a family together is a foundational part of recovery and well-being. Having rituals and routines, so the consistency and predictability of having a schedule, of having meals together, are examples of ways to promote closeness and being able to overcome hardships. Participation in other activities. Now, granted, this is much more challenging during COVID-19. There's a lot more safety precautions that need to happen, but being creative in the ways that some children might be able to connect over Zoom. They might be able to work on a creative project together. And having that participation in some sort of activities is very protective. Having a network of support. Now, these may be folks that you're not able to see right now. It might not be, there might not be a safe way to do it, but connecting over video conferencing, over the phone, writing letters. I have a neighbor who is a child who exchanges notes and letters with me. We drop them in the mailbox, and it's a way to connect without being physically with one another. Having strong emotion communication skills. I will talk more about this, but being able to identify one's emotions, being able to express one's emotions. This is really important for the adults in a child's life to model this and to support that type of emotional communication. Finally, helpful beliefs and positive meaning making. So by helpful beliefs, I mean generally an optimistic viewpoint. I don't mean that you or families need to be overly optimistic or take a Pollyanna approach that everything's okay, but believing that that things will get better, believing that there is hope and there are ways that there are things to look forward to. Now, positive meaning making could be particularly challenging if somebody has experienced significant stress or loss. In the moment, it can be challenging to think about what is the silver lining. But there might be some small examples. There might be some ways that kids have been able to connect more with relatives that they wouldn't normally have a video call with. There might be ways that are positive activities that families have been able to do as a result of spending more time at home and more time together. If somebody is experiencing significant stress or loss, maybe thinking about positive meaning over past stressors as a way to identify coping and meaning making that has happened for experiences that have happened in the past. Now I will get into the acronym called PREPARE, which is a way to support students, children, adolescents for school during the pandemic. And many of these will be relevant to supporting lots of different types of stressors. The examples and the focus will be around getting students ready for school. What I'll go through is how to probe gently, how to provide reassurance, how to explain, how to provide developmentally appropriate responses, how to answer questions, maintaining routines, and as I've already alluded to, that essential emotion coaching. So first we start with P, probe gently. Ask the child, what do they already know? You don't want to bombard them with information. You want to make it developmentally appropriate. I suggest starting with some sort of generic question or statement. What do you already know about the coronavirus or COVID-19? Kids might have one term or the other that they use. And making a statement that is accurate and not overly scary about what's happening. The coronavirus pandemic is happening all over the world. It's a statement of fact to give kids accurate information about that this is impacting everyone in the whole world. Find out what the child has heard and what they think. there may be some misinformation that's happening, or the child might have holes of information that they've used their imagination to fill in what's really going on. The theme here is that we want to talk about the stressor without overwhelming the child with information or overwhelming them and actually increasing their amount that they're afraid and they're scared about what's going on. So how do we do that without overwhelming? Well, we reassure. So being attuned to what might this child really be asking when they're asking questions? What might they really be nervous about when they're expressing some concerns? And this might be in words, it might be in behaviors as well. Oftentimes, children are wanting to know if they and their loved ones are going to be okay. And the way we can support restoring this sense of safety is talking about the ways that we are taking precautions to be safe. So things like maintaining our distance from other people, minimizing how much contact we have with other people, wearing masks, washing hands, doing this more so than we have before. This helps provide some reassurance in an accurate way. So we don't want to make a statement that is not true, such as, we know we're all going to be safe. We know we're all not going to get this. The reassurance is accurate in that we are trying to keep ourselves safe by doing these extra precautions and having these new routines of washing our hands more than we would, wearing masks when we go places in public. And this can also be aligned with, it's just like, when we cross the street, we look both ways as a way to be safe and not get hit and not to put anybody else in danger. When we get in the car, we wear our seatbelts so that if an accident happens, we have that extra safety measure in place. We also want to provide accurate information. We want to recognize when there's been a misunderstanding, use clear language and simple words. We want to keep our ears and eyes for behaviors open to what might be some possible sources of misinformation, so that we can provide this clear explanation of what's actually going on. Now, kind of a step away from explaining information about COVID-19 is thinking about if there's a trauma reminder. And what I mean by a stress or trauma reminder is something that's happening now that might take somebody back to a stressful situation. Let's say a child has had a relative who had a chronic illness, and this might remind them of the time that grandma was sick with cancer, and that might be scary. That might be something that is going on for the young person that they don't even know about. So keeping that in mind, that this could stir up some old feelings that are normal, that remind children of previous stressors. Now, this also happens to adults, so keep this in mind for yourself as well. Praise what's going well. So when you're having these conversations, when a young person asks questions, saying thank you for asking such a hard question, that can also be a way to support the questions that you don't have answers to. As a child's going through their routines, noticing, oh, I really like the way you did your chore. I appreciate that you did that without asking. And when you're having the conversations about their feelings of appreciating what they're experiencing, you're not minimizing, you're not telling them how they need to feel, but saying, that was really brave to tell me that you're scared about this. This way you are attuning yourself and children to, there are things that are going well, and there are ways that the child is handling this and managing this, that you're recognizing and you're appreciating. Providing developmentally appropriate responses. So you're thinking about, what does this child need? Using words that the child can understand. I was talking to my 6-year-old niece and I used the word pandemic, and I realized she may not actually know what a pandemic is. So I asked her about it. We pulled out a map of the world and talked about what that meant, that something was happening across the entire world versus something that's more localized. Consider their cognitive understanding. So if they have a large vocabulary, you may be able to use more sophisticated words. If they don't, thinking about what are the words that you can use to have them understand. A safe bet is asking, do they understand? And also using different words to describe what you're saying. So saying it maybe 3 different ways to try to meet the understanding of the child or children that you're talking to. Being aware that the child might have some magical thinking. They might need you to speak in really concrete terms about the information that you're providing. The child, may or may not have had previous experience with illness or death and dying. So what's their understanding of illness? And again, this is a place where you won't have all the answers because the illness impacts people in different ways. Asking or assessing the child's experience with risk and safety. If they are at higher risk, talking to them about, oh, because you have asthma, it's extra important that we take precautions, and extra important that we don't have you exposed to any unnecessary people. Now, children with more sophisticated viewpoints might have some existential struggles. This might be the first time that they've thought either about their close family members dying or getting sick, and they might actually start thinking about, what does this mean for me or for other kids? And this could bring about conversations about, you mean that kids could die too? You mean that kids could get sick too? And you answer that in an accurate way, as well as going back to our reassurance part of this, of the different ways that we are taking precautions to stay safe. Now, our next part of our acronym is answering questions. So I like that the first part of this, to answering questions, isn't the talking part. It's the listening part. What is the child really asking? What are they really saying? And engaging with them to understand what it is that they need. Now, this might take some time. So if there's a time period when a child asks a question and you don't have time to answer it, don't ignore it. Let them know, this is really important. We need some time to talk about this, and we'll come back to it. Even better to say when you're going to come back to it, if at all possible. This way, you can really listen, you can really hear what they need to understand, and answer one step at a time. A really anxious child could rattle off a bunch of different questions all at once, and take it one step at a time so that you can help soothe their anxiety and also address all of the different questions that they're asking. Now, remember to pause yourself and think through, what are you going to say, and what are the words you want to say? What's the message you want to convey? Continue to answer questions until there's no more questions and no more comments. This way, the child, everything that's on their mind can at least be expressed, even if you can't answer everything. My niece asked, when is the coronavirus going to be over? And this was a hard question for her to hear the answer of, we all want to know that answer and we don't know. She asked multiple adults in her life this question, because I think maybe she wasn't getting kind of a satisfactory response, and letting her know that that's a question that's on everybody's mind. We don't know the answer to it. The way that we can make sure we do solve the coronavirus crisis is by being safe, but it's likely to take a while. And that's not going to feel comfortable for you, that you'll have questions that you can't answer, but giving the information that we do know about the answer will be the information that's going to best support the child. This is adapted from a source to talk about difficult conversations, race and racism, but I really like the way it summarizes how to answer questions. So first, reiterating, restating what you heard. Are you even answering the right question that the child is asking? Then pause and contemplate what you actually want to say. Don't just answer impulsively. Respire, take a breath for yourself. And some of the questions, some of the comments are going to be hard for you to hear. It could stir up your own stress reactions. It could be hard that a child that you care about is having these kinds of questions. You could be stressed out from a million different things happening that doesn't have to do with the question, and then it's just one more thing that the child is asking you a question. So take a breath, check in with yourself, and then as you're responding, seeking to understand what the child's saying, if you're providing the information that is what they're wanting to get from you. And then in more emotionally charged conversations, assuming positive intentions. Now, as you're answering questions, it's not a one-time, let's have a conversation with your child or with your students, but leave the door open to ask more questions. Now, from your perspective, check in frequently with children. And also let the children know they can come to you at any time with more questions as this happens. Some of this will come up naturally, but letting them know that this is something that is going to be an ongoing conversation, because it is going to be an ongoing part of their life and their worries and what they think about. Children will grow, develop, and learn new information. I'm thinking about as school is starting, and there may be more sharing of information. Some might be accurate and some might not be accurate. Even the way that your child is getting ready to go back to school, explaining to them of why it's a remote learning setting or why things are looking different. That's new information as well. There will be new questions that come up, and keeping that invitation, that door open, and then checking in frequently, not having it be a one-time conversation. Now we're at the second R in prepare, which is routines. Maintain as many routines as possible to support predictability and stability. This is important for kids. It's really important for adults as well to keep a schedule. Now, be flexible, be gentle. If one day the schedule goes out the window or needs to be adjusted, it's understandable, and that flexibility will be beneficial in, well, we need to change things up, or, oh no, we need to make sure that we stick to this schedule. It's important right now for everybody to have good sleep hygiene, adults and kids. This is one of the handouts on the Focus Foster website about healthy sleep habits. I like this because it's very simple in terms of having a schedule, being consistent, making a bedroom something that is conducive to sleep, having electronics and things that are not a part of sleep not be in the bedroom, having it be a separate space for that. Having other influences like exercise and caffeine and heated conversations right before bedtime, how those impact sleep habits as well. Routines don't have to just be about school or work. They should also be fun things, and not just things that the family's looking forward to once the pandemic is over, but having a movie night, having a game night, having a picnic, something that can happen in a couple of days or a couple of weeks that everybody can plan and look forward to. Part of breaking up the monotony, part of breaking up the every day kind of seems the same, can be having something that is looking forward to, as well as building that protective factor of spending time together and having fun together as a family. Now we're on to emotion coaching. This is another handout that's on the Focus Foster website, the Feeling Foxes. I really like these because kids who can read the words on them, and kids who don't know how to read can look at the fox's facial expressions, and maybe they use a slightly different word, but they can see which one is happy versus nervous versus frustrated, and start to adopt those words for themselves as well. Now, it's important to validate emotional experiences. It's not really a good idea to ever tell anybody how they should be feeling. How they're feeling is how they should be feeling. As adults, we can model healthy emotion communication. We can label our own emotions and experiences. We can provide suggestions to kids if they're having a meltdown where they're crying and refusing to move. You can say something like, I can see how this situation would be frustrating right now, or I'm wondering if you might be feeling mad right now. Adults in the kids' lives should try to display a wide expression of emotions, and that includes educators, providers, healthcare workers. It's all part of healthy emotional development to have this modeling for kids with as many adults as possible. Similarly, modeling adaptive coping. If something frustrating is happening, you can say, oh, I'm feeling frustrated right now, and I'm just going to take some deep breaths, or I need to go let off some steam and go for a walk with the dog, to show the child what you're doing and that you're being intentional about your coping. An educator can do this too. Oh, I'm getting a little upset right now because the Zoom isn't working the way that I want to, but I'm going to pause and I am going to think, I can get through this. This is going to help me as I am working through this. Thank you all for being patient with me. Very simple, can integrate it into the words and tools that you're doing. You don't necessarily need to do a separate lesson on emotions. You can integrate it into school as is. There are other tools for emotion coaching that I'll get into that don't involve the feeling words. That can sometimes be more accessible, particularly when people of all ages are having a hard time expressing themselves. So now I'll go to some questions that were received about this topic. One question was, what do you suggest to do as a mental health practitioner or educator if children are asking questions and their parents don't believe in wearing masks? And during the live presentation, we had some great responses, such as having a conversation with a parent. Hopefully you already have a relationship with them where this doesn't feel awkward, this doesn't feel uncomfortable, but talking to them about reputable sources, that there is science behind wearing masks, and in many instances, it's the law to wear masks in public. Somebody else also pointed out that it's our obligation to provide accurate information to students. If a parent was teaching a student that 2 + 2 = 5, we'd still teach them that 2 + 2 = 4, even if the parent was teaching something that was counter to it. And I think that's a good point, because our the wearing masks is based in science, and there isn't questions around whether or not that's a safe practice to be doing, or a safer practice to be doing. But it's challenging, because there may be a difficult conversation to have with the parents about that this is part of what you'll be talking about, and it's essential in supporting students, and going back to providing accurate information, and the reassurance piece of that's part of how to reassure young people in their concerns. There was a question about positive toxicity, and what does this mean, and can I give an example? And I think this question came from the optimism and the meaning making. The term toxic positivity is one that's mostly used when someone's denying or minimizing or invalidating something that's actually happening, something that's an authentic experience. And that is, it's not recommended to be inauthentic. It's also not recommended to walk around with blinders on and to think, oh, this is going to be okay. This is going to be positive. We're all going to get through this. The pandemic is almost over. We don't know that that's true. The balance is having an optimistic outlook, having hope, while balancing that with the reality of what is actually happening. We also had a question about interrupting children's play to correct them. And with play, it's oftentimes a way for younger children to communicate. So when you hear something that might be inaccurate, if you're observing, you don't need to in the moment correct them. You might, take them out of their zone of what they're doing. You might lose some valuable information by interrupting it. I would recommend that the child and that whoever they're playing with, at some point, you have a conversation about, when you were playing, I heard, one of your characters talk about that the coronavirus doesn't make anybody sick. I wanted to sit down and talk with both of you about what that is and what that happened, and providing the accurate information. Now, if you're participating in play and that happens, you may be able to actually weave this into how you're playing, and you can correct in that way as well. All right, now we are going to move on to talking about resilience. And what is resilience? Well, resilience, it's kind of a hot ticket item in the last several years. And I like this picture because this tree has been through some windstorms and has demonstrated some resilience. So maybe some leaves or some branches blew off during the windstorm, but as a result, it adapted and changed. It's now leaning. Probably the roots are stronger than ever as a result of its ability to grow and change. This is one definition of resilience, is the ability to effectively cope with, adapt to, and overcome adversity, stress, and challenging experiences. So this is a little bit more than the ability to bounce back, but it's almost like bouncing forward. The growth and the overcoming part of this definition is really helpful to keep in mind with resilience. Now, we know from lots of research that there's ways to build resilience. And the FOCUS model, or Families Overcoming Under Stress, was developed out of UCLA with Patricia Lester and Bill Saltzman, working on prevention skills to help families overcome adversity and families cope with stressors that were upcoming. Now, since the development of FOCUS, it's also been used as an intervention for families who have already experienced stress and trauma. And these are the 5 resilience skills that this model focuses on. I'll give you some tools on specifically how to how to promote some of these skills without going into all 5. The 5 are managing feelings or emotion regulation, communication, goal setting, problem solving, and coping with stress, trauma, and loss reminders. So I promised you a tool that didn't necessarily involve feeling words, and this is it. I really like the feeling thermometer because almost all verbal children can use this, and nonverbal children who have the cognitive abilities to identify their comfortability could use this. The idea is when we're down in the green zone, we're really comfortable and calm. When we're in the red zone, we're really uncomfortable, the most uncomfortable. In the yellow zone, you're a little uncomfortable, not necessarily so much so that you can't think or can't play or can't function. It's just a little uncomfortable. That can actually be a good thing. It can be motivating. It can be just enough anxiety to complete your homework or just enough anxiety to work on a tough project. The orange zone is pretty uncomfortable. It's getting up there in terms of not doing our best thinking or learning, not doing our best functioning, kind of a warning sign on the way to being very, very uncomfortable. What I like about this is that lots of different feelings can go in these zones. I could be a little sad and be in the yellow zone, or I could be the most sad, the most uncomfortable, and be in the red zone. And children with younger developmental abilities can use the colors or the numbers, and more sophisticated emotion language can be built onto the feeling thermometer using feeling words. Now we can pair these two up with having the feeling box be in different zones. And again, this can be done with or without the feeling words as well. A way to practice doing this is to talk about different scenarios. This can be with people in the family of I'm in the green zone when I eat ice cream, but my brother is in the orange zone when he eats ice cream because he's lactose intolerant and it's going to give him a stomach ache even though it tastes really good. I've also found it can be helpful with the pets. You can say, well, the dog is in the green zone when they're on the walk and they're able to sniff and see other dogs. And the dog is in the orange zone when they're really hungry and they're waiting for us to feed them. Another way to use this feeling thermometer is with family members all together. So the self part of the feeling thermometer can be the child of, in the scenario where I get my favorite food, I'm in the green zone. How does that make the other family members feel? If they like it, they might also be towards that green zone. And if they don't like it, in the red zone. It can also be helpful for stressful situations. If a child is stressed out about a argument that they had with their sibling, you can see how it affects the other sibling if they were in the same zone, and how it affects the other family members as well. Well, for me, that really stressed me out because I was trying to have a quiet time and you two were arguing. Another member of the family might say, it didn't really bother me. I was in a different room. Had my noise canceling headphones on, and I kind of tuned you out. There are some tools for getting back down to the green zone. So one is this deep breathing tool for children. This is a script of how to help children understand how to take long, deep inhales and long, deep exhales. There's lots of different things like this available on the internet and in different settings. So there's nothing that is magic about this script. It's an idea and is an easy tool for family members to be able to use themselves. I also like this list of getting to green strategies because when we're up in the orange and the red zone, it can be really hard to think about what are good strategies to use to help get me back down to the yellow or the green zone. So doing this proactively and doing this ahead of time to think about these things have worked for me. These are some things I'm willing to try. And then I appreciate the blank spaces because this list isn't meant to be all encompassing. There's lots of different ways to get back down into the green zone that aren't necessarily on here. And it also promotes that different things work for different people. It's not a formula that will always work for everyone. So these are nice ways to just start to brainstorm ideas when you're up the feeling thermometer of what could be helpful or what could be a preventative strategy when I feel that I'm starting to get up the feeling thermometer. This next handout is called It's a Good Habit. What's really helpful about this is it helps enforce routines and rituals by going through and having the parent or caregiver's understanding of chores and responsibilities, and then the child's idea of what this is. And this can help identify some misunderstandings and make sure that everybody's aware of what everybody else is being asked to do. And I actually have a video demonstration of this. I'm just going to adjust my settings to make sure that the audio portion of this will work. Give me just a moment as my PowerPoint wakes up. The demonstration is of a caregiver and a young person walking through this with a provider. It's helpful to know that you don't need to do this in a clinical setting. You don't need to do it with a provider. It could be done with families on their own, and it is a way to support communication and understanding.
Last time we met, I know that there were some questions that came up about chores and that there may have been a little bit of confusion and expectations weren't very clear. Do you remember that?
Yeah.
Okay, so what I wanted to do today was kind of go over a couple of things that will help us continue to enhance the communication between the two of you, but also get you to be on the same page about what those expectations are about chores. When we have really stressful times, it can be really hard to communicate clearly. So if we have this set up ahead of time and we have very clear expectations, not only does that help you continue to be close, but also it helps you to be supportive of each other. So what I'd like us to do is we're going to work on this worksheet that's called It's a Good Habit. This is going to help you guys get on the same page about what the expectations are about chores. So we'll start with the first one, Lucas. Can you tell me what that says?
Going to bed and getting up in the morning.
So, Mom, what's your understanding about your rule about going to bed?
9 p.m. the latest.
It's 9 p.m. Okay, so I'm going to put that down here. 9 p.m. is bedtime. And what time does he need to get up?
At 7.
To be ready for school?
Yes.
Okay. What about you, Lucas?
I agree with this.
Is that your bedtime normally?
Yeah.
Do you stick to that?
Yeah, I usually go to bed at 9.
Okay, so I'll put that down here. And getting up is the same as well?
Maybe like 7:10, like 7:15.
7:20, we push it.
But what time are you supposed to get up?
7.
Okay, so you know that is the expectation.
Yeah.
Okay, so we'll put that down here. So it sounds like you guys are on the same page about that one. Okay, let's move on to the next one. Getting your homework done.
It's a big one.
Mom, what's your expectation about getting homework done? When does he need to have that done?
I'm not home right away when he gets home from school. I work and I'm home like around 6. So he needs to get started right away. So when I come home, we can spend time together. We can have dinner instead of him rushing and getting through the stuff.
So what time is that? That he
He
needs
should just do homework right away as he gets home, like 1:32, maybe 2 p.m. or so.
2 p.m. Okay.
He has plenty of time. Everything can be done.
Lucas, what's your understanding of that rule?
I don't really like doing my homework when I get home because I want to watch TV, get a snack, just like go on my phone, talk to my friends.
So you're not quite ready to get to do homework as soon as you get there?
Yeah.
Okay. So I wonder if there's a way we could meet in the middle, Mom. Is there a way that maybe he can have a small break when he comes home?
I get that.
What would be reasonable?
About like 3 or 3:30. We can play a little bit, watch TV, get some snacks, and yeah. But at least by the time I get home, you're almost done or done, and
Okay.
then we can just watch TV together or have dinner.
Okay.
So 3:30 sounds good, Lucas?
Yeah.
Okay. So we'll agree to.
So this demonstration shows it's the process of sitting down and having the conversation as a family. There isn't anything special about having a neutral party, although for highly conflictual families, it could be helpful to have that. It's a great way to get people on the same page and to either define or start to establish routines and expectations. Now, this next one is one of my favorite reflection activities. It's called Same, Different, Better, and I'll also show you a demonstration of what this looks like. This is a nice way for families to think about a situation, an event, something that happened in their family, and reflect on what's the same, what's different, and what's better. This could be a nice activity for teachers to do. If the first grade classroom is coming in and they're really proud that they're in first grade, they could talk about what's the same about being in first grade than kindergarten, what's different, and what's better. And each child could have the opportunity to participate in this. And similarly with families, a family who experienced a transition or a move, each family member gets to say what they think is the same, different, and better. This could be something that is around the pandemic. I wouldn't recommend it if there's a significant loss or the family's going through grief. But if the family is able to think about some things that are different and better, I think this could be something to just share experiences around the impact of the pandemic. So as I told you, I also have a demonstration of this, and this is with two caregivers. And in this demonstration, one has a chronic illness. And what we'll see is reflecting on their participation in their treatment. But again, this doesn't need to be done in a clinical setting. It can be something that is a family activity that is planned. So as you can see, the video is buffering. So we'll see if we can get it to go. And this is oftentimes a nice way to see different perspectives and to share experiences, because there isn't anything that's right or wrong about the experiences of being same, different, and better. It's purposefully not meant to be something that is that there's any judgment to this. It's all about sharing one another's experiences. So what I'm going to do is just start to talk about some of the other tools and resources that I have. And again, these are on the Focus Foster website. One of them outlines what daily play could look like. And I think with daily play, we often think about this with young children. It's important with children of all ages to have some special dedicated time. Now, yes, it would be nice if the daily play could happen with a caregiver or parent every day, but life is life. It may not happen every day. The idea of daily play with younger kids is that the child gets to choose the activity. The caregiver follows the child's lead in what they're doing. And in this, the only rule is that if the child does something dangerous, does something unsafe, that would be the reason why the caregiver would interrupt and not allow the child to go forward. This is a part that's common with young children. I think the nice way to adapt it with teens and older children is to think about, what are they into? If they're always on their phone, what is a way that a caregiver could engage with the teen or the adolescent? Hey, can you show me something on your phone? Or I love when teens are into music. Can you play me a song and tell me, something about why you like that song or why you like that particular artist? And the nice part about this daily play ritual, it doesn't need to be a long time. It can be 3 minutes, it can be 5 minutes. And it's a nice way to appreciate the child and to give specific attention. Children want to be heard. They want to be valued. They want to know that what their experiences are something that adults are paying attention to support their growth and their development and their interests. All right, so I have pulled up this video again. I'm gonna hope for the best. And this is again demonstrating the same, different, better handout.
Now reflect on what this process has. Now that you've gone through the focus program, I thought we'd take a moment to just kind of think about and reflect on what this process has been for you. So one activity I like to do is called Same, Different, Better, where it gives you an opportunity to think about some things about your family that remain the same. What are the things in your family and your lives that are different? And what are the things that are now better than they were before you started the program?
Okay.
So who would like to start?
Well, it's different now for me because I have pretty much doctor's appointments every day. So that took some getting used to.
Okay, so in terms of different, you have many appointments? Is that correct?
Yeah, doctor's appointments.
What else?
I don't think Brianna has as much energy as she used to, so she's not able to put in as many hours at work. It has been taking just a slight financial strain on the family.
Okay, so another thing that's different is there's some financial strains.
Yes.
Bella, what do you think? What's one thing that's different about your family?
Now we cook Saturday breakfasts together.
Oh, so is that something that's better?
Yeah.
Okay, so cook Saturday breakfasts. That sounds like a fun activity.
I also understand why my mom goes on to these appointments now.
So that goes under better?
Yeah.
Great. What would you guys say is the same for you?
We still appreciate and love each other.
Yeah, that didn't change.
And I still go to the same school and see all my friends.
Great. That's a good thing to see have your same friends.
Yeah.
I feel like one thing that is better for me, the community is just coming around and dropping meals and checking in, and that feels good.
So having more support.
Yeah.
Yes, indeed.
We made more friends now than ever before.
That's wonderful. It's good that you're making use of those supports.
Yeah.
It's very important.
It's very helpful.
It's actually a strength.
Yes.
Anything else you guys would like to add?
I think what's different is that we don't take things for granted. You know, we just live for the day. We improvise a lot more.
So it helps you appreciate
Yeah.
everything. I think these are some great thoughts and some great ways that you guys have reflected on how your life has remained the same, what things have changed, what's different, and what's better. Every time you have a big change in your life, you know, it's really good to reflect upon those things. So I hope you will continue to do that in the future.
Yeah, we will.
Yeah, this has been great.
Thank you.
So this is the daily play handout that I was alluding to. And one piece that we've talked about earlier is this praise part of it too. So noticing, particularly during this playtime, of what you like that your child is doing, and emphasizing that. I really like the way you handed that to me. Thank you so much for playing nicely with your toys. For the older teens, oh, this is great to see what you're into. Oh, this is so neat to see, you know, how you're interacting with, you know, on your phone, even if it's something that might annoy you in other ways when they're doing it, when you're trying to have a conversation with them. This is not a time to rattle off lots and lots of questions. In fact, I'd say try to keep your questions to a minimum. You could make statements. You could wonder, I wonder, you know, what makes this something that you spend a lot of your time doing, and then they can fill it in, or making a statement that is something that they have the option of responding to or not. We ask kids way too many questions. How was your day? What color is this? What sound does the cow make? Da, 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 da. Most of those questions don't mean anything. So we want to have the questions that we ask be meaningful questions. And when we're asking them, really honing in on what they're saying, how they're responding, and appreciating that they are actually taking the time to answer them. With teens, they don't necessarily have to be showing you something. It could also just be a conversation. There could be, you know, something about what's going on in the news, or what their thoughts are on politics, or what they think about the way that their school is being run. It could be a conversation that is specifically carved out to pay attention to them. So in addition to the Focus Foster website, we have some other free tools. There's a mobile app, one that's called Focus on the Go, and I'll show you some of the games that are on there. And then there's also a Focus on Foster Family app where you can access these handouts as well. The two websites that are free are focusfoster.org and focusworld.org. Focus World is for a little bit younger children, and I'll show you a demonstration of some of the tools that are there. The Focus on the Go and Focus on Foster Families has a couple of games. We have our Buddy Bear main character here, and Buddy Bear has a problem-solving game where you have to move the sticks to get the ball into his cozy cavern. He has coping skills that he tries to get, and as he gets the coping skills, he moves down the feeling thermometer. As he hits the red chilies, he moves up the feeling thermometer. The Feeling Finder game is probably the one that can be adjusted up into adolescence. There's different levels of how easy and how hard the words are to find. And it can help with emotional vocabulary and matching the feelings to different colors in the feeling thermometer. Another one that might be good for older school-age children or adolescents is the Comic Creator. There's different bear avatars and ways to create a story and create a comic there. These are activities that are great to do one-on-one with kids. If you have an iPad, you can sit next to each other. They can also be ways that educators can recommend safe, free apps to their students of ways that they can play some games that increase their social emotional learning, as well as ways to share with family members. Focus World is an interactive environment that supports resilient skill building. And there's resources that are in here that are intended to improve family closeness. So the Fox has a living room and these different stars have different activities. There's, for example, you click on the clock and there's a handout about creating a family calendar and family routines. The bookshelf has some other focus resources as well. There's a memory game. This used to be a game that I played all the time with physical cards as a kid. And this has the feeling boxes. You can change the number of cards that are there. So younger children, fewer cards, and more advanced with more cards. You can take this to the next level if they make a match and the two proud cards, each person playing could share a time when they felt proud or share an example of when somebody might feel proud. Now let's move into our final section where we talk about support for adults. This is challenging work. As I said, we're all experiencing increased stress and there may be other things going on, sick family members, loss of jobs or financial instability, decreased social connections that we're feeling the impact. And this is mostly focused on how to support kids, but in order to support kids, the adults also need to refuel their gas tank. Take some time for your own space, your own reflection. This can be emotionally draining. It can be painful. You may be experiencing grief or loss. I encourage you to take time for yourself to reflect and recharge so that you can be the most supportive adult that you can possibly be to the children in your life. Sounds so easy, right? Well, here are some things to keep in mind. Your own routines, your own sleep, exercise, eating healthy foods routines are really crucial to be able to be your best self right now. It also helps protect your immune system. So prioritizing these, knowing that this is part of what supports the kids who are around you is one way that can be helpful to prioritize. Setting boundaries. Don't feel the need to say yes to everything. Don't feel the need to overschedule. Don't feel the need to accomplish everything. Be it work boundaries, personal boundaries, social boundaries, in not overloading yourself and really sticking to the limits that you set. Set manageable goals for yourself. If you're behind on cleaning up your house, don't have your goal be to clean the whole thing in one day and scrub it from top to bottom in the deepest deep clean you've ever done. Think about what is attainable in the next hour, half day, if you have the day off to be able to do this, and make it something that you could reasonably achieve and accomplish. In the spirit of having an optimistic outlook, one way to do this is to look for the silver linings. What are some things that are going well? What are some news stories that you've heard about that really put a smile on your face? In the springtime, I heard about high schoolers having their prom at home. I've heard some international news, the singing in Italy, the cheering in France for healthcare workers that is happening nightly. This might be a time when there's more video calls with loved ones than before. I know that's something I'm experiencing, of connecting to people over video and more frequently than I had before. This might be a great time that you've been able to complete some projects around your home. There's an increased live stream of animals being born at the zoo, for example, and other opportunities that you may not have tuned into. These are some examples to get you started in thinking about what are some positive parts that have happened without taking away from the serious impact of the pandemic. As I said, this isn't meant to be a Pollyanna approach that everything is okay, everything is fine, there's no need to worry. That is not what I'm recommending. It's seeing the things that are going well, appreciating those things while knowing that this is a serious situation. Taking the time to be gentle on yourself. It's okay if your concentration is not what it used to be pre-pandemic. It's okay if there's a day where you don't feel as productive. Thinking about ways to connect with others in a safe way, if it's more texts or phone calls, outdoor socially distanced connections with small groups. If there's a way to have better connections with the people that you're living with, the people that are in your bubble. And just as I said for kids, it's really important for adults to also have their routines and their schedule on track as much as possible. Be gentle on yourself if you have a day where you're off track. Tomorrow's another day to get back on track. And you can also build in one thing at a time to establish a schedule. If it's kind of a free-for-all at home right now, what's one thing that you can do daily for your schedule and build off of that? Now, I've heard a lot about news intake, and I mentioned before that news intake can be extremely harmful. My recommendation is get your news on a need-to-know basis. Don't overconsume or underconsume. I'm going to mostly focus on overconsuming. Think to yourself, is this something I need to know, or is this just extra information? I recommend scheduling a time when you check in with your news, maybe once in the morning and once at night. Having those check-ins be credible news sources like the World Health Organization, the CDC, a reliable local source like a county public health agency or a well-known university, and limit the news that you're getting from social media, because that is news that's being pushed to you. It's more likely to not be accurate. It's more likely to be appealing to things that you have previously clicked on, which is a biased source then. Let's talk a little bit about educators and using affirmations. These can be used in the classroom. They're also helpful outside of the classroom. So if you're doing your classroom through Zoom, you can say something like, I love seeing all of your faces. I've missed you so much. I'm glad that I can see you even if we can't be together. In whatever way students are participating, thank you for participating. Oh, it's so good to hear from you. It was so wonderful getting many of your homework assignments. I think another way of using affirmations is for the adult themselves. So when you're having a tough time, acknowledging this thing I'm dealing with is tough. That's not just specific to educators, right? This is a tough time, and having some compassion for yourself. Also having a shared humanity in this. You're not alone in that this is, you might be suffering. You're not alone in that this is hard and stressful. And giving yourself some positive nourishment. May I be caring with myself today? May I be gentle on myself today? Encouraging a holistic check-in of students. What are some feeling words you're having? What's something that's brought you joy? Promoting coping, maybe doing some coping within the classroom, maybe talking to students about how to cope outside of the classroom, building their confidence both through acknowledging what they're doing, as well as activities to support their confidence and sense of mastery. Supporting adaptability and flexibility. So if there's work that needs to be done that requires certain materials, giving options for that. In whatever ways possible of supporting social skills and support. I read an opinion piece in the New York Times by the founder of the Khan Academy, and he was talking about the importance of students working together on problems. An example that he gave is if you have access to breakout rooms, so teach the lesson and then have students work together in small groups in breakout rooms to support that connection. Another way to promote support is to have students share ways that they're coping, ways that that they're able to manage their stress as well. It's something that I think is going to have a lasting impact on kids, is their lack of socialization. And I think there can be some ways to buffer this and promote social skills and support in a virtual setting, and having that translate to their home bubbles as well. Incorporating social emotional strategies using something like a feeling thermometer or those feeling foxes, having regular check-ins on that. This can be a way to promote discussions on tough topics like the pandemic and racial injustices that are happening. Remember that kids are going to need brain breaks. You can do some grounding exercises, some breathing exercises, some imagery exercises. Those are available on Focus Foster if you don't have another go-to source for those. There's also lots of nice online strategies. Calm has a bubble that expands and contracts to help kids breathe according to that circle. As I said, emphasizing the social support piece and relationship building. Who in your life can you go to when you're having a hard time? Who in your life is somebody who has good strategies that you want to try yourself, or you've really admired seeing them doing? Promoting and prioritizing collaboration, communication, self-awareness, and community. Making the time to explore and learn about the students' experiences. What's it like being at home? Is this, I bet this is tough. It's an adjustment for all of us. So acknowledging that we will have feelings about this. This might be more challenging than usual. Older kids might be needing to tutor their younger siblings, and that might be creating pressure or stress, and talking about that and normalizing it can be a way to promote social emotional learning. Be aware, especially in the beginning of this next school year, there are going to be increased negative behaviors and decreased attention spans. We don't know what's been going on for students in terms of their structure, in terms of their learning at the end of the spring semester or quarter, this might have been a while since students were being asked to sit and focus for hours or even minutes at a time. And with that, I will wrap up and say that this has been an absolute pleasure to be able to deliver this information. And I hope that these strategies can be integrated into your different work settings with children to bring greater awareness about what they might be going through, to have you feel more secure and more confident in supporting students in growing their social emotional awareness. And I also hope that you'll be able to use some of these strategies with the kids in your life, and then of course in your own social emotional development. It's an ongoing process. It's something that adults don't always consciously pay attention to, that knowing that you need to be able to be equipped and aware of what's going on for you emotionally and you in terms of your energy resources to be able to support students, support children in the work that you're doing. So thanks so much, and thank you for your dedication to the young people you're working with.